Welcome. Good afternoon.
Good afternoon, Dr. Jameson.
Greetings, everyone. How does the attendance look? Should we wait a few more minutes, or do we have our quorum?
Maybe one more minute would be good.
Excellent. Greetings, Jose and Valerie and Levon.
Good
Quincy.
everybody.
Owen.
Hello.
Sarah. Yes. Teresa.
Good afternoon, everyone.
And to the rest of the team, Katie and Nick and Janelle and Rosa, everyone.
Hey, Dr. Jameson, I think we can get started if you're ready.
Yes, it sounds like we do have our quorum. Did you want to do roll call by checking in on the site and seeing who's attending, or would you like to call it?
I will call it. I'll just start with a few housekeeping and etiquette reminders if I could real quick.
Thank you.
So we have Caitlin here is hosting this webinar. As a reminder, please keep yourself muted if you are not the one presenting or making a comment. If you would like to make a comment, please raise your hand, your electronic hand, or indicate in the chat box that you would like to make a comment, and Caitlin will unmute you. For those on the phone, please remember to mute yourselves, or else we will hear your private conversations. Madam Chair, there may be people on the telephone that would like to make a public comment or in person today as well. So we just want to remember to ask if there is any public comment on the phone. We also have our Carson City Conference location open to the public, so public comment may come from there as well. And a reminder, for anyone speaking, please remember to state your name for the record before making a comment or presenting. I've been reminded about this now that a session has started down the street here, and it's always helpful to have someone state their name when making a comment so we have an accurate and clear record. So now I will take roll call. Dr. Jameson. Zoom, I'll have you
Present.
Great. Ms. Valerie Clark.
Present.
Ms. Levon Lewis. I see you there, Ms. Lewis. I'll mark you present. Dr. Sarah Frieden.
Present.
Great. Mr. Jonathan Johnson. Absent. Mr. Jose Melendrez.
Present.
Great. Mr. Quincy Branch.
Present.
Great. All right. And our ex officio members, Stacy Weeks. Absent. Interim Commissioner Nick Stosik.
Present.
Great, thanks, Nick. And another new face as an ex officio member, Teresa Baldwin. She is representing Director Stevenson's office in the budget office.
Present.
Great. I also want to make one more introduction. We have our new Deputy Attorney General, Radhika Kano on the phone.
Present.
Great, thank you. All right, we have a quorum, Madam Chair. And you may be on mute, Dr. Jameson.
Yes, Florence Jameson, and welcome everyone. Now that our meeting's been called to order and roll call, and just a reminder about announcing ourselves as before we speak. Thank you so much, Ryan. We're going to first go, of course, to our public comment. Do we have anybody present, north or south, or on the line?
And I think Dr. Jameson, yes, we do have some public comment here present in the Carson City office, and I'll hand it over.
Thank you, Ryan.
Dr. Jameson, Madam Chair, Tiffany Davis for the record. I do want to state we do have our Fallon Tribal Health Director and a few of his associates with him in the room. I do believe they want to make public comment towards the end. Right? Oh, we'll go ahead and do it now. Here you go.
Good afternoon. My name is John, the Health Director for the Fallon Heights Children here in Nevada, North Nevada. We're here today on support of the exchange's agenda item to address the tribal sponsorship implementation. I read through the proposal that Tiffany handed me, and we'd like to encourage you guys to consider this. It would be a great benefit to my tribe as well as the other tribal health centers in the area. We're not looking at becoming the certified enrollment counselors, but more of the tribal representatives. And as indicated in your agenda request, all those items are very specific to us and very necessary as we move to implementing our own sponsorship program. I know there's only right now McDermott that does it, but I believe ourselves, Reno Sparks and Pyramid are definitely looking at that as well. So I'd just like to throw my support behind this proposal that has been submitted to you guys on behalf of the Fallon tribe. Thank you.
Madam Chair, Tiffany Davis for the record. Once again, that would conclude our public comment here in our Carson City conference room. And I would like to ask if Caitlin could please confirm if we have any public comments at this time online, or maybe those people want to make public comment at the end of the meeting.
Hi, Caitlin Blagan for the record. It looks like Angie Wilson has her hand raised. So Angie, you can go ahead and unmute yourself and speak.
Hi, good afternoon. Can everybody hear me okay?
Yes.
Okay, great. This is Angie Wilson, the director of the Reno Sparks Tribal Health Center here in Reno, Nevada. And I do also have public comments and consideration. I know that we've been meeting with Tiffany Davis, our tribal liaison to the Nevada Health Link, in regards to a pathway for a viable tribal sponsorship program. So I just wanted to reiterate a couple of comments in support of, the designation of a new tribal enroller opportunity. The Affordable Care Act provides an opportunity for any tribe to establish a tribally sponsored program to purchase health insurance coverage for their uninsured tribal members through the health insurance marketplace, or in our case, the Health Link. The Indian Healthcare Improvement Act specifically authorizes that tribes may use our funds made available under our Indian Self-Determination and Education Assistance Act to purchase health insurance. And that, our members of federally recognized tribes across this nation have the right to open continuous enrollment. Can you guys hear me okay?
Yes.
Okay, sorry. And I'm not sure if you may know, but I used to serve on the board of directors for the Nevada Health Link years ago when we were just transitioning from Xerox, I think at that time. And at that time, there were so many issues going on with the state, but one of the things I continually said is there needs to be a pathway for tribal sponsorship. The state-based exchange that we've had has been up for 9 years at this point, and we still don't have a viable pathway through for a viable tribal sponsorship opportunity. And so I'm very encouraged. I appreciate all of the hard work from Tiffany and of the tribes, really looking at ways that we can do this. The Affordable Care Act has specific provisions that support American Indian and Alaska Native beneficiaries. And the largest benefit is that there is zero cost sharing for American Indian and Alaska Native members who are enrolled in a federally recognized tribe and are 300% federal poverty level or less. And what this means is that there's no out-of-pocket expenses or charges to our members who are eligible for these services. Right now, our tribal programs pay for these costs out of our programs here called purchase and referred care. And oftentimes we're paying 100% of the billable charges, which I'm sure you can understand are very concerning for us. The opportunity that we do have the ability to actually purchase insurance off the exchange, you know, being able to look at oftentimes our tribal members in our communities are within that 300% federal poverty level is a huge issue for us. We know that American Indians and Alaska Natives are the only population right now that have open continuous enrollment with the health exchange all year long that could come on a program or off a program at any given time. And this really allows us in Indian country to be able to look at ways to better support our patient population, to look at ways that we pay for the health insurance for our members, that we look at ways to create better access to care for our First Nation folks, and looking at ways that we might be able to do that here through the exchange. You know, I think that for us, I would just say my last comments here is, you know, we really need a way that helps to support this process. It is a barrier for us to be able to have our folks come through what's established as a state-based certification program. We're not looking at upselling. You know, our goal is to look at bronze level plans to be able to get our folks into those plans in an efficient way. And our overall goal, we do feel like this is a win-win where, you know, we get more Nevadans to be able to be eligible for the exchange, more people signed up for health insurance, you know, through the exchange, and, you know, to solidify, you know, finally having a really a great opportunity for the Nevada tribes to be able to work with our Nevada Health Link to make this happen. So I appreciate and want to thank you all for hearing our comments today. We do understand that the board of directors does have the authority to authorize an exemption for tribal enrollers so that we can move forward with this process. I do appreciate it, and thank you so much for allowing us to speak today.
Angie, thank you so much for the comments and also for all that information, which I'm sure that everyone that's listening may not have been familiar with all of that, and it's extremely helpful for many of, I'm sure, our members to hear that history. Thank you so much. And now I think if there's any other comments, otherwise we will move on. Okay, so no other comments. We're going to start with the approval of the minutes from our December 14th, 2022 board meeting. And if we could have someone move to approve those minutes. Take yourself off mute.
So moved, Jose Melendres.
Thank you, Jose. And a second.
I'll second Quincy Branch.
Thank you, Quincy. And we'll take a moment before we pass and just ask if there's, after reviewing the minutes, if anybody had noted any errors, any omissions, or if they feel there were any additions that needed to be made to the minutes on December 14th, 2022. You may speak now. Hearing nothing, then I'll go ahead and call for a vote for the approval of the minutes for December 14th, 2022. Everybody in favor, you could just, what are we finding is the most effective? Because we're all on mute, would everyone raising their hand be most effective? Ryan, what do you think the best way to do that for our voting?
I think the voice is good if you want to.
Okay, let's start with the voice,
your
and if
name.
there's a question, we'll go to hand raising. So everyone in favor of passing our minutes from December 14, 2022, please say aye.
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 Anyone oppose? And has anybody abstained? All right, then the minutes are unanimously passed. We are going to go to our very exciting portion, the Executive Director's Report. Ryan Heyer, please.
Great. Thank you, Madam Chair. So it's a pleasure as the Executive Director of the Silver State Health Insurance Exchange to present this Executive Director's Report, recapping the exchange's successful fourth open enrollment season as a state-based exchange. It is with great pride to say that the exchange had its second best year ever, enrolling 96,379 consumers for plan year 2023. This total enrollment number breaks down to 18,117 new enrollees, 13,602 active re-enrollees, meaning re-enrollees that came back on the exchange and shopped, and a little over 64,000 auto re-enrollees. Furthermore, an impressive 86% of those who shopped received some type of financial assistance, and 40% of consumers received plans with monthly premiums of $100 or less. For healthcare to be accessible, it must be affordable, and consumer shopping on NevadaHealthLink.com found that to be true this year. With a November 1 start date, the exchange launched open enrollment with a press event at the Southern Nevada Health District. This professionally produced event had print and television press in attendance, and the event was streamed live for broader viewing. Speakers included Nevada HealthLink's board chair, Dr. Florence Jameson, SNHD's Executive Director, Dr. Michael Johnson, Nevada HealthLink broker grantee, Alberto Ochoa, U.S. Congresswoman Susie Lee, and myself. A focal point for the event was the unveiling of the exchange's media campaign, Our Plans Are Made for Your Plans, as well as consumer testimonials. Additionally, carriers staffed tables to provide information to consumers and answer any enrollment or plan questions consumers may have. While the exchange was competing for consumer attention against a nationwide midterm election and the Thanksgiving holiday during November, enrollment momentum began to pick up in December and carried through mid-January. The open enrollment advertising campaign proved effective, and a comprehensive recap will be shared later in this meeting. Of other important note is the start of the 82nd session of the Nevada Legislature, which kicked off on Monday, February 6th. Exchange team members will be actively tracking and testifying on bills impacting healthcare and health insurance during this session, which runs until June 5th this year. Exchange fiscal and operational staff will be presenting and championing the exchange's biennial budget for fiscal years 2024 and 2025. The exchange's full governor's recommended budget may be found at the link provided in the report. Now on to vendor management. The exchange and its contracted eligibility and enrollment platform and call center vendor Get Insured provided near error-free service via the enrollment and eligibility system powering NevadaHealthLink.com during plan year 2023 open enrollment. This was no small feat, especially in light of the exchange offering a record level 163 different qualified health plan options through 7 qualified carriers and 18 qualified dental plan options through 5 dental insurance carriers. Clark and Nye County consumers had the choice of 104 plans offered via 6 carriers. 88 plans were available in Washoe County from Aetna, Hometown Health, HPN, Anthem, and Friday Health Plans. 58 plans were available in Carson City and rural counties, Douglas, Lyon, and Story, from Hometown Health, Silver Summit, Anthem, and Friday. And then 51 plans were available in Churchill, Elko, Esmeralda, Eureka, Humboldt, Lander, Lincoln, Mineral, Pershing, and White Pine counties. Regarding qualified dental plans, the exchange was proud to offer 18 QDPs, about 5 dental carriers, Alpha, EMI, Delta, Best, and Rocky Mountain. Consumers continue to enjoy savings thanks to the continued increased subsidies offered via the Inflation Reduction Act, such as subsidies being applied to consumers making over 4% of the federal poverty level and increased subsidies being applied to all consumers under 400% of the FPL. In fact, almost 5,000 consumers received subsidies over that 400% threshold, whereas this was not an opportunity before the American Rescue Plan Act or the Inflation Reduction Act. Another 11,000 plus consumers locked in plans for plan year 2023 at $0 monthly premiums. Again, over 11,000 Nevadans shopped and found plans for $0 a month. Consumers and broker sisters alike were happy with the Get Insured operated call center, which offered extended hours during this past open enrollment period. The broker navigator line was open from 9 to 7, Monday through Friday, and the consumer line was open 9 to 5, Monday through Friday. On Saturdays and Sundays throughout open enrollment, both lines were open 9 to 5. I am proud to state that the call center wrapped up open enrollment, boasting a call center consumer satisfaction score of 93%. The exchange concluded plan year 2023 open enrollment in its second year with its second year with its marketing and outreach vendor, the Abby Agency. Following my report, communications manager Katie Charlson and the Abby Agency will highlight the success of our marketing and outreach strategies and campaigns. It'll be a fantastic presentation, which was centered around the theme, our plans are made for your plans. Now switching to preparing for the end of the public health emergency. As featured in past board reports, the exchange continued to work in coordination with the Department of Welfare and Supportive Services and the Division of Healthcare, Financing, and Policy to adequately plan how to best service Nevadans needing health insurance coverage in the event they transition off of Medicaid. And this will happen when redeterminations begin in volume at the end of the PHE. We now know this will happen beginning in April. The exchange continues to actively plan and coordinate with the two aforementioned state agencies and its vendor, Get Insured, in order to assure that Nevadans in need will properly and efficiently be account transferred to the exchange for a seamless opportunity for coverage. So some of the features of our transition plan here, or the unwinding plan, we've had monthly meetings with the state's Medicaid agency and Medicaid managed care carriers to discuss strategies and touch base on each entity's respective unwinding efforts. We've also invested approximately $30,000 so far in paid media efforts to reach Nevadans with messaging, encouraging them to update their contact information, which is critical at this time, with Medicaid to be prepared for changes as a result of the PHE unwinding. We've also implemented media tactics, including billboards, social media, and Google ads targeted towards individuals who likely are on Medicaid. We developed a PHE toolkit in both print and digital formats. The physical toolkit includes a poster, flyer, and rack card that we created and co-branded with Medicaid. That includes high-level information on the unwinding and simple steps Medicaid enrollees need to make to continue coverage. The digital toolkit includes social media posts and talking points. Both toolkits are in English and Spanish. We have created a list of 300 community partners and health organizations and social service organizations who will receive the toolkits and help distribute this important information and timeline to Nevadans all over the state. After April 1st, the exchange will increase the paid media budget to about 25% of our special enrollment budget. At that time, we will explore more outreach opportunities such as events, social media, Facebook Live recordings, grocery store ambassadors, etc. Outreach to providers such as physicians and hospitals, we will provide outreach to providers such as physicians and hospitals to amplify messaging about Nevada HealthLink in the event a Medicaid consumer who has been redetermined ineligible realizes their loss of coverage while at a provider or know it's upcoming. Enhancing the Consumer Assistance Call Center, we will also enhance the Consumer Assistance Call Center by adding additional customer service reps to perform direct outreach to consumers transferred over from Medicaid. Additionally, the exchange realizes that navigators and sisters are the frontline resource to getting Nevadans informed and enrolled. We are providing navigators and sisters with printed and digital resources to keep consumers informed as things change. We also plan on leveraging our navigators with Medicaid to be deployed where Medicaid may need them, whether that be at local statewide events or in offices. Navigators will also continue to be at events throughout the community to help Nevadans be informed, and educate them on how to avoid a gap in coverage. And then finally, in my report, federal and state updates. The exchange's continued success this past open enrollment was due in no small part to us being touted as the most important, impactful congressional action since the adoption of the Affordable Care Act with the passing of the Inflation Reduction Act. As a reminder, the IRA extended temporary increased subsidies from the American Rescue Plan Act for another 3 years or through plan year 2025. Enrollees in the Silver State Health Insurance Exchange recently received consumer-friendly news with clarification from the Internal Revenue Service regarding expanded application of the affordability calculation of employer-sponsored coverage, or what's commonly known as the family glitch. As a result of the family glitch, family members of workers, primarily low-income workers, who were ineligible to receive premium tax credits through the health insurance marketplace, even when family coverage was unaffordable because the calculation was based solely on the employee and does not factor in the entire family. Now, the fix now includes calculating affordability based on the entire family and their costs. The enrollment and eligibility platform on Nevada Health Link now includes this calculation. And switching to state updates, there are 2 important pieces of legislation from the 2021 session the exchange continues to follow closely. The first is AB 432, which will designate the exchange as an automatic voter registration agency. The exchange has actively been working with the Nevada Secretary of State's office in preliminary planning regarding information we currently collect in our application process, as well as technical questions. The second piece of legislation is SB 420, commonly referred to as a public option bill. The exchange continues to coordinate with Nevada Medicaid in the planning and design phase of this initiative, and will closely follow any legislative changes to this bill that may come out of this current 82nd legislative session. Thank you, Chair.
Florence Jameson, Ryan, hi, thank you so much for your report, as always, so thorough. And I do, of course, I always like to tease you just a tad bit. It appeared a little shorter because you used a smaller font this time. At this I'd like to take an opportunity now to see if some of our board members or anyone on our call, some of our other guests as well, if you have any questions or comments on that report. I would like to congratulate. Oh, yes, I see a hand up. Levon, please.
Yes, I would like to congratulate Ryan and the staff for the enrollment. Having been on this board since its inception, I am just so pleased to see everything going so smoothly. And you all are doing a wonderful job. And I think the fact that this was our second greatest year was just really exceptional. And thank you very much for all that you've done to improve the operation of the Nevada Health. Thank you.
Thank you. And all the credit goes to staff.
Thank you, Levon. And I would like to echo what Levon said. It's always an especially challenging year for us when we have our limited advertising budget to put our message out there whenever we have our elections. So we came considering that we had so much less airtime, TV time, etc. And it was put into such a shorter period of time. You got everybody, our exchange, our PR, marketing did just an incredible job. And I did want to just take a moment and say that I really want to thank you for, we talked about a lot of this at our last meeting, but on a couple of points here, it has just been, as Levon said, from the early days when we had such a limited number of carriers and such limited number of plans, especially in the rural area. As you have shared these numbers with us, especially the rural area, how many plans and how many providers we have out there, it is just an outstanding, gives an outstanding opportunity for our customers of the exchange to be given such just a wide variety of options. And that is so exciting how you guys have worked so very hard with all of our providers to just expand the providers and the number of different plans, and especially the rural area, which at one point sadly was down to like one provider and like hardly any plans at all. So this is just magnificent, the coverage that you've worked so hard to get. And in addition, we've been just anticipating and worried about how things would transition. And for over a year, you prepared for the end of the public health emergency. And again, as you have summarized for us what you have done, including the media tactics, the toolkits you've made available, the increase paid for the media budget. There's just literally like nothing that you haven't done that I think any of our board members can think of. You have just done everything imaginable to enhance the customer assistance in this transition of going off the Medicaid and onto our exchange, hopefully. And I just want to congratulate you on this extensive work. I mean, really, really extensive work that you have done in order to do that. And the way that now as we really are getting rolling up, we know that it all comes down to one-on-one almost all the time. And you really need those navigators. And they have the way you are planning to provide the navigators and assisted with all their printed materials, and you're really leveraging our navigators, deploying them at this time for transition. This just honestly, I can't think of anything you guys haven't done. So I want to congratulate you, because for these individuals, if you had not done this amazing, all this planning, all these different ways to bring them in and provide them with the health insurance, many of them would be a lapse without insurance or just fall off plans altogether. And thanks to you, you're going to help fulfill our goal as the exchange, which is that nobody goes without their much needed health care. You guys have done an amazing job. And finally, I just wanted to congratulate you because the call center wrapped up with an enrollment boasting of satisfaction survey of 93%. Bravo, bravo. Thank you so much, staff of the exchange, led by our director, Ryan High. You really did an amazing job. And honestly, you've been juggling so many things, including trying to figure out how to finally bring to fruition taking care of the opportunities of offering the health plan on the exchange to our Native Indian tribes. So you guys have juggled so much. I really don't know how you do it all with your limited staff and your limited budget. So congratulations. And does anybody else have any other comments before we move on?
You see? Sorry.
Dr. Jameson, it looks like Angie has a comment.
Angie, yes, please, Angie.
Thank you. I also I appreciate the comments, and I just wanted to also say I do appreciate the work of Ryan and his team. I think you hit it on the head that, you know, they've been very responsive to the Nevada tribes as we've been walking through this process. I think it's also exciting as a Nevada resident to see the advanced premium tax credits being expanded. And I cannot express how important that is in our state, especially we all know the impact of inflation and some of the high costs that lead into the social determinants of health. And so I just wanted to give a just recognition from here at the Reno Sparks Tribal Health Center how much appreciated we are. We appreciate his work and outreach to us as well. So great job. We noticed the hard work and very, very excited for it. I also just wanted to give a quick mention that we are also excited to see some of the marketing on some of the billboards and things here that represent our Native folks. So thank you so much.
Thank you, Angie, for your comments. And as we move on, I'll just also add the which is in process here, the fix of the family glitch, which we were discussed last time. This is truly exciting and look forward to hearing more on that. So moving on to our marketing and outreach update. Did I miss any other hands that might have been up? No. Okay. So who's going to go ahead and start our marketing update?
Hey, this is Katie Charlson for the record. Thank you, Madam Chair. I'm going to give a quick summary of my board report, and then I will have the Abbey Agency show their beautiful presentation and everything we've been doing these last few months. So open enrollment for plan year 2023 concluded on January 15th, 2023, and a 5-day extension until January 20th for consumers who completed their application but hadn't selected a plan. We enrolled a little over 96,000 Nevadans into health insurance for plan year 2023. A fully developed marketing plan for open enrollment period was completed and approved in September 2022, and production of the newly vetted messaging created concepts began. Campaign production included a full week across a variety of locations in Las Vegas and featured diverse of locally owned businesses and Nevada locals as models. So we didn't use actual actors this year. We used real Nevadans, which I'm just so proud of and so happy the Abbey Agency found these amazing Nevadans, and they did such a good job and just looked beautiful. And we got to shoot where they were actually had their businesses. So it was just an honor to do that. And then starting November 1st, we started our messaging, or our window shopping messaging assets were pulled from traditional or from the market. And then we started our open enrollment campaign. And the open enrollment press conference took place in Southern Nevada in Las Vegas with our director, Ryan Hyde, kicked off the presser with multiple speakers, including Congresswoman Susie Lee, the Southern Nevada Health District Director, and of course, our chair, Dr. Florence Jamison, one of our brokers, Alberto Ochoa, and a consumer that had testimonials for Nevada to seek free assistance and enroll in health coverage. A public health fair with Nevada on exchange insurance carriers followed the press conference, and we also had one in Northern Nevada in Reno at the library with some of our carriers, Nevada Health Link staff, and Community Health Alliance, one of our navigator organizations. The purpose of this event was just to educate and to inform Nevadans about health insurance through Nevada Health Link. Through December 2022, the Abbey Agency worked on a creative campaign evolution that focused on the urgency of the enrollment deadline, and our countdown assets were launched January 15th through January 1st through the 15th. And the Abbey Agency and Marketing for Change, our research company who subcontracted with the Abbey Agency, developed and tested a variety of creative campaign evolutions from the open enrollment period plan year 2023 campaign. These evolutions were meant to test the messaging and best ways to deliver the message. Based on our research, the following storylines were developed, all hinging on using local businesses to represent real Nevadans. So we did the Own Boss, and it depicts a barbershop, a food truck owner, realtor, housekeeper, landscaper, being experts in their respective fields with a voiceover, "Our plans are made for your plans." We also did a food delivery driver and a rideshare driver, illustrating that Nevada Health Link connects with independent contractors and gig workers to comprehensive health insurance. And then we had our own ads for our taco truck, barbershop, and part-time worker. As we know, Nevada has a really diverse working population, and we really concentrated on the top jobs in Nevada that aren't considered traditional and don't usually offer insurance. We also kept our Being There ad from our previous year that takes you through a journey of a father and son as they grow up together, and the son has an accident and the father is there making sure that he has health insurance. And our target audience identified for the campaign are currently enrolled and need to re-enroll, and those who had not enrolled yet. Uninsured Nevadans, rural Nevadans, individual and families statewide, 50+ age group, 26 to 45 age group, young invincibles, members of Nevada tribes, Hispanic, Latino, Asian Americans, Asian Pacific Islanders, African Americans, and multicultural populations. We also created a tribal guide this year that we were able to get out to all of our tribes, so the breakdown of all the benefits that they have. I'm really happy about that. We're going to keep expanding on that. We're working on revamping our tribal website or our tribal page on our website too, and make it a little bit more user friendly so that everybody understands all the benefits they have through the exchange. For public and media relations, the Abbey Agency and Nevada Health Link, we're committed to reaching Nevadans from all backgrounds and to help them learn about affordable health insurance options. Nevada is more diverse than ever, so we really have to hit on every single channel to make sure we're meeting people where they're at. For open enrollment 2023, we have highly effective tactics to reach these historically underserved communities, as well as the remaining communities in Nevada. Overall, the Abbey Agency and the Exchange allocated to spend broadly across diverse range of media channels to ensure Nevadans are reached on all platforms that they frequent. So we did all of our traditional billboards, radio to build awareness of Nevada Health Link and open enrollment period through the Exposure for Our Plans Are Made for Your Plans campaign. The blended traditional and digital placements from partners like Las Vegas Review Journal, the Reno Gazette Journal, moved individual from awareness to consideration. We also had a lot of quite ads, but editorials in our rural newspapers, which was really great. And we had our brokers involved, our rural brokers, and then also testimonials from consumers. As our call to action was going to NevadaHealthLink.com and checking out the plans and finding a plan for them. For the earn media metrics, we had over 180 pieces of coverage with an estimated reach of 2.7 million. Very exciting. And then for outreach and community relations, as I said before, we had our health fairs at the beginning of open enrollment, which were very successful, and I look forward to continue to do those every open enrollment, kind of build a yearly thing out of that. Additionally, we've got an ongoing community event participation, including attendance at all of the senior expos, UNR home games, Vegas chambers, and various community events. And then Erica Avelis Consulting, who is another subcontractor with the Abbey Agency, provided Hispanic and Latino collaborations with organizations serving in underserved communities by facilitating and securing tabling events and sponsoring those communities. And for overall for open enrollment, we're just encouraging non-enrollees to find an insurance plan that best suited to their needs. Really encouraging that we have a lot of plan options. We can find something that works for you, and to come check us out. And we have messaging across all the social media channels: Instagram, Facebook, Twitter, LinkedIn. Additionally, TikTok was incorporated into the regular schedule of posts on primary platforms. So we're trying that out this year. We also work with like the city of Las Vegas to do joint TikToks, which is really successful. We're happy with that. The content correspond with themes outlined in the broader open enrollment plan, including being your own boss, our plans made for your plans. The theme is bolstered through a wide range of age demographics and shown through imagery that shows that healthcare is not one size fits all situation, relates of Nevadans or is for Nevadans of all walks of life. Spanish content was also developed in a variety of social posts. And this year, also for our open enrollment, we started doing Facebook Live, which was community partners, which was amazing for me just to meet these community partners and hear about all the great work they were doing, and be able to promote them and promote ourselves as well. We started off with the LGBTQ Center for Southern Nevada, with Mona Lisa Paulo, Nevada Health Link, the Food Bank of Northern Nevada, with Nicole and Boley, our quality assurance manager, Shay Herbert. We talked about scams and how to make sure you're on the right website. And we also met with the city of Reno and did one in Spanish with Councilman Martinez. All I have for my report, and then I will let Abbey Agency do their presentation.
Thank you for that very thorough report. And I think the only comment I can make after hearing about everything you did is, wow. It is It is an impressive report, and as we now had a whole year that we weren't worrying about COVID, as you guys have geared up again, the list of your event participations it's just amazing. I can't imagine how much more you guys could have done than you did. You guys didn't go the first mile, the second mile. You guys really covered the territory in every media. And as we talked about last time, you're expanding, Instagram, Facebook Live, TikTok. You guys really do rock. So I look forward now to hearing the second half of your report from your partner. But first, because that was a lot, are there any board members or any other comments on what we just heard? Just outstanding work. I'm checking through for any hands up. Does anybody else see any other hands up? Not seeing any hands up because you were so thorough. Nobody has any questions they need to ask. We will move on to the second half.
Well, thank you. Good afternoon, Dr. Jameson.
Good afternoon.
And good afternoon to the entire board as well. We are so thrilled to be able to present these reports to you. I definitely have to give a huge kudos to our entire team and our partners, Erica Aviles and Marketing for Change. Going into our second year, I think we really hit our stride as far as how we all work together with the exchange staff, and we are very happy to have the second best year ever. Of course, we were hoping for the first, but as Dr. Jameson, you mentioned with the economy the way it is, I think with the election, there are some factors out there outside of our control. So I will share my screen and we will walk through a few slides. I know that in October, we showed you the campaign as we were developing and where we were going. We have some actual final assets that we'll be showing you today, and then we'll be sharing some pictures of us at events. We'll be talking about some of the website visits and paid media visits as well. So first and foremost, going into this year, plan year 23, we wanted to make sure that we were evolving and building off the brand awareness that has been developing over the past many years, and then that we feel that we really capitalized on in plan year 2022. We wanted to reiterate some key messages throughout to make sure that, again, we were really tying health insurance to that core need that lives within every individual. So we really focused on motivation, health, value, authenticity, and flexibility. And as Katie mentioned, critical to our campaign this year was real Nevadans in real live places. This year, we conducted a new partnership with Marketing for Change and the Exchange data staff and QA staff, where every other week, so twice a month, we came together and looked at enrollment data at that point in time to identify where we were at year over year, changes we were seeing, and how we could change our outreach tactics to help identify any areas where maybe we were falling behind from the previous year. Currently, we are working with Marketing for Change on 2 surveys, and we will have quite a bit of data on those surveys next week, and then we can share at the following board meeting. But we are doing our annual Public Insights survey, which is a sample of over 2,000 Nevadans, where we're learning about their awareness of Nevada HealthLink, if they saw an ad, how they responded to that ad, and what their overall perception is. So far in the early review of the data, we saw 37% have awareness and positive awareness of Nevada HealthLink. So that's a great number. And we can compare that to our survey from last year and identify different growth that we saw either through demographic information or geographically. We also are working on a survey of all of the enrollees to understand more information about them and what drew them to make that purchase, because we want to find out what motivated them and how can we use that in the future to motivate even more individuals to become enrolled and get health insurance so that every Nevadan has health insurance. So we're excited to report back on those surveys very soon to the exchange staff and then also to the board in future meetings. I'll let Tyson talk about our 3-phased approach to creative.
Thanks, Connie. Hello, board. I'm Tyson Kowal. I'm the creative director here at the Abbey Agency. I know many of you have not met me. They keep me locked up just working in the graphic design programs and whatnot. But no, I've been working behind the scenes for the last 2 years on this project, and it's been so fun to watch it grow and have everybody, you know, help get it to where it is. So I just get the lucky part of presenting it to you. Like Connie said, we built this out in a 3-part series, of course, starting with the window shopping period, right? Starting to get people ready and warmed up for open enrollment. You know, once a year is almost here. Our messaging stayed very clear and concise, reminding people that they can shop for plans and find assistance at nevadahealthlink.com. And then one great number we got to kind of ride the wave of was the amount of signups last year. So last year, more than 100,000 Nevadans signed up. That is big momentum, right? And when there's big momentum and energy, people want to be a part of that. They want to grab onto it. So we really bolstered that piece of data.
And I will play that video very quickly. We have just 2 quick videos. It's always fun to watch.
Once a year is almost here. Health insurance enrollment opens November 1st. Now is your chance to sign up for qualified health plans and lock in savings at nevadahealthlink.com. Don't miss this once-a-year opportunity. Pick your plan now.
Thanks, Connie. Like you said, we really the window shopping period campaign was really graphically driven, right? We know open enrollment definitely got into the characters and the people and the faces and the personalities. And to piggyback off what Katie had mentioned, we used real, you know, we didn't use any actors, we used real Nevadans. And most of these folks were in their real occupation. Some let us come to their, you know, their food trucks. Some let us come into their restaurants and others in barbershops. Like, we really got to meet some awesome people. But what we got to do is focus on occupations and meeting Nevadans where they're at and showing that Nevada HealthLink has options for whether you own a small business or you just work for yourself. You know, we've got many options here. So here's some of the creative we saw. This year was down in Las Vegas. Last year was up in Northern Nevada in Reno. So we were able to change locations, get some different scenery, and really show more of the state. And for the rurals, watch out, because next year we're coming your way. Next slide, please. Again, some more creative, a lot of interactive Pinterest ads and social media. We did instant experience ads, and here's our taco truck video. That's undoubtedly Las Vegas there.
One moment.
There's no street address to your business, but somehow the word got out. You created something special last year. 9 out of 10 Nevada HealthLink enrollees got financial help on their health insurance at NevadaHealthLink.com. Our plans are made for your plans.
Just a quick one. I know everyone's seen the creative, so but it's good just to show it one last time. So that would be the second phase of our kind of approach. And then our third phase, right as the deadline is coming near, we need to, you know, remind people and don't put your health on hold was kind of what we came up with. Again, another deadline message to get people to act and kind of if they had put it off until then. So yeah, that I'll make it quick. I know we've got a lot of slides. It's really nice to see and meet a lot of you, and thank you for all the kudos and support. And we look forward to next year. Thanks, Con.
Tyson. I will turn it over to Julian, our paid media director, to speak to our paid media strategy.
Hi, everyone. Thank you. It's nice to meet you. Thanks for the introduction, Connie. So what we do on our side of the world is put all of that amazing creative in market in front of the right people. Building on top of that, we heard the message and integrated highly effective tactics targeting those hard to reach communities, as well as the general target audiences. In addition, we of course leveraged our data provider partnerships, census data to reach diverse communities across the state, and of course those hard to reach rural areas. Some quick highlights are that the traditional media garnered over 113 million impressions, while the digital media reached audiences on an average of 3 to 7 times per person, which is good for retention of the ad space. In the rural Nevada, we had some traditional print partners and digital channels that also geofence specific secluded communities. So what that means is that we definitely heard that we had to be in every community, and we put little tiny fences around them to reach them with the right ads at the right time, the right amount of times. As well as diverse communities, these are some tactics listed to help reach across the Latinx, African American, and the Asian American Pacific Islander. Again, it was a mix of all these tactics and channels, paid social, YouTube, etc. Next slide, please. And on this side, you'll see broken out. I want to point out the big number. Of course, those impressions I just previously mentioned. However, the biggest thing here to note is that our added value was over 140,000. What that means is that we leverage our relationships building on top of consecutive years of partnerships and collaboration. And additionally, we were able to negotiate heavily on behalf of Nevada HealthLink with any new publisher partners in the space. Next slide. And then you'll see our traditional, our digital broken out here. Again, those numbers just mean that's a frequency, that 44 million is a frequency of 3 to 7 on all the tactics that we use. So each time, that's how many times they saw it per tactic. Again, some of the highlights here to note, the smaller numbers on the bottom are the increases of percentages from the previous year. Again, we take these numbers and we keep honing in, optimizing, and try to get them in the right place. So the bottom left, I also want to point out, and this could be due to the political landscape, is that we had a drop in CPC, which is good for us. That means everybody was exhausted of all the political ads. And then in our window at the end of the year and right in the beginning of the new year, it got less expensive for us, meaning our marketing dollars were more effective. Next slide, please. Again, here are more numbers to show how the campaigns broke out with the key messaging. Again, what we take from here is interest in ads. We see a click-through rate for window shopping above 3%, which is good, as that's definitely recognizable, as that's what happens during open enrollment in the pre-phase. That's when people first start hearing about it, employers and etc. And then the bottom, we have combined the open enrollment and the deadline numbers. And from here, our goal is, of course, to get those people signed up right away. But at the end, we really make sure to reach them. And that's why there's, of course, more dollars spent here. Next slide, please.
This shows the breakout of English and Spanish.
Yes, perfect. Thank you. And finally, we have the English and Spanish metrics, which tells us how we're splitting our message to our language speakers. But beyond the numbers, what we do on the back end is continue to measure creative comparisons from Tyson's team. And then we hone in on which images resonate best with our audiences and leverage those. And next, I will pass it back to Connie for some web analytics. It's nice to meet everyone.
Absolutely. Thank you, Julian. So our goal, of course, through all this is to make sure that people are aware of Nevada HealthLink as an option, and then to drive them into converting, right? And encourage them to actually take that next step, shop for a plan, pick a plan, and then enroll. We made quite a few updates leading into open enrollment and throughout open enrollment to optimize the website. We created landing pages that were both in English and in Spanish. And then on the Spanish page, the Spanish landing page, we created a searchable broker and navigator tool where individuals could search for brokers and navigators close to them that spoke Spanish. We're very excited about that tool, and we can absolutely use it in other Nevada HealthLink pages down the line. We also created and focused on SEO this year. And what SEO is search engine optimization. As Katie mentioned in her report, we did a Facebook Live about scams, and the scammers were out strong this year. If you were Googling Nevada HealthLink, health insurance in Nevada, there was a lot of ads put behind that. And so we were counteracting that with ads. We also wanted to make sure, though, that if somebody were looking below the ads, Nevada HealthLink was always the first option that popped up, and that we were the trusted organic source. So our search engine optimization efforts included updating meta descriptions, as well as backlinking strategies to ensure that we were the #1 organic source. And throughout Bing and Google, we were that. Year over year, we saw a 13% increase in total users coming to the site. So that is phenomenal. To see that more and more people were going to the site. Here is overall some of those key analytics, but 350,000 total users came to the site. Those users had a total sessions of 738,000, and then over 16 million page views. That, of course, is a high number. As you know, when you're going through the enrollment process, there are quite a few pages. Once you learn about what you're going to select, going through and actually completing that application. However, we did see those pages per session and session duration go down year over year. We were glad to see that. We want people to get through that application process easier with less time and less pages. So we've been working with Get Insured and the team on that leading into open enrollment, and we'll continue to do so year over year. And we've been very thankful for the partnership that they've provided to help bring those numbers down. So they are small year over year decreases, but still important year over year decreases. So we were glad to see that. The bounce rate did go up year over year. It is still well within an acceptable range, and much less than other websites. Here is just some highlights of traffic by channel. Overall, 33% of people who came to the Nevada HealthLink website were driven there by paid media efforts. We saw that Twitter, Google, and Facebook drove people there the most. We aren't surprised to see Google up there. Oftentimes you see TV ads, you see a billboard, you even see something on digital, your social media feed, and then finally you choose to go to Google or another search engine platform and then type in Nevada HealthLink health insurance, and then you get there from that. Overall, we saw that many people were on the home page, then we're finding specific information about open enrollment, and then finally going to the login page. We still saw most users coming from mobile devices, which is typical with how people interact with the website. We saw 35% on their desktop, which means that, you know, as users are going through the process, they likely are switching to their desktop. We saw primarily male, just 55%, so not too high, but of all the users on the site, 55% were male. And then, as you may expect, the majority of the users of the site are between the ages of 25 and 54. Overall, 47% of the site visitors were from Las Vegas. Reno had 11% of site visitors, and then the trailing metros after that, or geographic areas, were Carson City, Pahrump, Elko, Mesquite, Ely, Eureka, and Fernley. Interestingly, just a fun fact, year over year, Ely and Eureka had a very large, over 1,000% and then over 2,000% increase year over year. We think a lot of that is because, as Julian mentioned, in our paid media, we did specific geofencing focused on those rural areas. And so we're able to see increases year over year of them coming to our website. So that's great. And then blog performance, we focus on the blog a lot because that helps with SEO. That, the more new website content you put on your site, the amount of backlinks you have, the amount of content we can talk about helps us to rank higher. And then of course it encourages people to see us as thought leaders that we are. So our blog this year had 8,700 page views, and the time on page was over 3.5 minutes, which is great. It means that the blog content is relevant. People are reading it. We also had a lower bounce rate on the blog than on our overall site, which means, again, when people are being pushed to the blog, they're seeing it as a valuable resource and they're staying there. Our newsletter performance was up year over year, so that was great news. We had an open rate of 19%. Our clicks were up to 738,000 clicks, which is great, and our click rate was up. Overall, though, we sent less emails. So that means that people were receiving less emails. We were targeting them better to our audiences with the right content, encouraging them to click through. And then I will turn it over to Alexis to speak to public relations.
Hi, everyone. I'm Alexis Keith, the PR manager at the Abbey Agency. So we implemented a strong public relations strategy to reach consumers with messaging about open enrollment. So as Ryan and Katie had mentioned before, we kicked off really strong with a press conference with the Southern Nevada Health District and a health fair to follow for one of the first and only times we've ever had all carriers in the same room for our consumers to be able to talk to about their different plan options and get to know the carriers. And we also implemented an event later in the week in Northern Nevada at the downtown Reno Library and invited consumers to come and talk to some of the brokers and get information about enrolling. And additionally, in that first week, we helped organize a roundtable for Ryan to speak with the U.S. Secretary of Health and Human Services. So really kicked off strong, even with there being the election within the first week of open enrollment. And there was an event with Obama on the day of our press conference. Despite all of that, we still had really strong turnout and press for the opening week of open enrollment. And we really continued that momentum throughout open enrollment with continued press releases, media pitches, dozens of interviews with Ryan and Katie and others. And so during open enrollment, we really tried to focus on a diverse set of voices within our PR strategy as well. So for example, we had, board member Dr. Jameson join our press conference. We had broker Alberto Ochoa join our press conference as well and do a couple media interviews with Ryan. We also secured a couple of consumer testimonials as well, which we were able to drive on social media, as well as placing an op-ed. So really a driving force all around with raising awareness towards open enrollment and reaching the consumers. We also really wanted to get a better understanding of what some of these consumer challenges are. So as Connie had mentioned, with the scams and discount plans really affecting consumers with the advertising side, we were also wanting to make that a priority on the public relations side to continue spreading awareness on how to get enrolled and doing interviews around that so that consumers know to go directly to NevadaHealthLink.com. Do not give your phone number to any of these scammers out there, and the frustrations of getting hundreds of robocalls and Nevada HealthLink often taking the blame for those calls, even though we know it's not from us. There's so much confusion there. So really trying to amplify that message through our media efforts, as well as we did a Facebook Live around that, and there were blog posts. So really tying all of those messages together. Additionally, we understood that there were some challenges in the rurals, and for PR to get a better understanding of what these challenges are, we set up individual phone calls with the brokers in several of the rurals. I think we talked to 3 or 4 different brokers who are based in our rural counties to get an understanding of where these folks get their news, for one, who is a trusted source for them to get this information. And as well as what are these challenges to enrolling? What are the barriers to them? So these phone calls were very helpful. And towards the end of open enrollment, we were able to secure a handful of placements in the rural areas, knowing that this is where they consume their news. We had a couple different op-eds from the rural brokers that were able to directly talk to these consumers and let them know they have someone in their area who understands what they are going through and can help them get insurance. So that was a priority for us throughout open enrollment, as well as our multicultural PR efforts, which Erica will speak to in a moment. But from all of this, we resulted in over 184 placements, 2.7 million estimated coverage views. We knew it was a priority to get more face-to-face interviews, and we did so with about 18 different interviews. I'm sure Katie and Ryan are like interviewed out with how much they were doing towards the end of open enrollment, as well as placed about 4 different op-eds and letters to the editor with messaging around open enrollment and 25 backlinks from our online placements. And then here to the right, there are some photos of Ryan speaking at the press conference. We had high praises from Susie Lee's team, saying it was one of the most colorful and visually appealing press conferences they've ever seen as compared to the ones they do up in Washington, D.C. So that was huge compliments, but overall was really, really strong on the PR side. And I will kick it over to Owen to talk about community relations.
Good afternoon, Owen Truesdell from the Abbey Agency. I can speak a little bit to community relations, which we do throughout the year and is intended to be an additional amplification effort of our public relations and paid media and creative efforts. In particular, our goal is really to have a in-person physical presence in all of our communities, but especially our target communities around multicultural, Hispanic, Black, African American, and AAPI audiences. We also do quite a large number of sponsorships in order to get the Nevada Health Link name out in the community so that folks are seeing our name in multiple places. And we're really reinforcing the fact that we are present in the community and have folks who are available to speak in person through our great navigators and in-person assisters. In particular, we really do look to have a wide number of events in Southern Nevada and Northern Nevada. We understand that we are limited in our ability to have an in-person presence in the rurals, though that's obviously something we are continuing to try and navigate around. And lastly, we use these events as an opportunity to kind of add media value in terms of PSAs, radio remotes, and social sharing. That's one of the things I think we did a really nice job of this year, building off of last year's efforts, is making sure that we, not just that we were at these events, but that we were capturing photos and worked with Ryan and Katie's team, especially Griselda, who is new to the Nevada Health Link team this year, and really making sure that all of that information is shared with our navigator partners. So Connie, if you can hop over to the next slide. You can see just a little bit of the number results. We attended 68 events during the window shopping and open enrollment period with 23 event sponsorships. Navigators reported more than 80,000 event attendees and nearly 20,000 participant interactions. We also put a list of some of the events that we attended. I think the really big thing that this aspect of the work does is highlight that in-person assistance and the fact that Nevada Health Link does put a lot of effort into making navigating health insurance and getting health insurance as easy as possible. And so I think that these in-person events really do underscore that brand value. And so we continue to do that work throughout the year. And I can turn it over to Erica to speak a little bit about our multicultural engagement in particular.
Thank you, Owen. Can you hear me?
Yes, thank you.
Awesome. Thank you. My name is Erica Aviles with Erica Aviles Consulting. It's such an honor and pleasure to be with you today. And I'm grateful that we've had another full year of really working really closely with the Abbey Agency and Marketing for a Change and all of the different board members and the team at Nevada HealthLink, and how grateful we are for the opportunity to keep growing our presence, building that trust on behalf of Nevada HealthLink and really building that rapport. And it makes me so full of joy and pride when I'm able to share, across with the community, across the state, all of the different tactics and resources that Nevada HealthLink and the exchange continues to invest in the community, not just from an advertising, but from a PR community outreach. Because I think Nevada HealthLink is who other entities look up to, right? As someone who is doing that and really making sure that we're engaging with the community, not just during open enrollment, but during the year all around. And that's something we're working on and continue to work on this year, on building those relationships. And we had some great successes on previous relationships established on, amplifying those during open enrollment and really working with our media partners, our stakeholders, and taking those relationships and opportunities to the next level by curating special events and community sponsorships, as well as curated pitches, because we understand a scam may look different from, depending on the audience, right? And really making sure that the trusted voice or the partner delivers that message. So it was really great working with the team on some of these entities. So really that multi-pronged integrated approach, and having, as well as Connie mentioned, the landing page in Spanish, having the application now for the first year in Spanish, having continued content, right? I think it just really continues to resonate with the community. And I think why more partners continue to want to collaborate and really amplify those relationships throughout the state. So this year we worked closely with entities such as Clark County, which donated PSA time across their Channel 4 station, City of Las Vegas. And then for our first time, the City of Reno recently launched a Facebook channel in Spanish. And we were one of the first to have a conversation with the newly elected Councilman Martinez, right? So it was really making sure that we stay on top of trends and opportunities and, taking care of our relationships to identify win-win opportunities. And that's, things that we were able to do with the African Diaspora, Solutions for Change, REACH, and really come up with innovative ways that we can continue to amplify open enrollment, but finding these other, things that the entities may need support with, such as the scams or such as, support with speaking with the community in person, and just hearing and listening and coming back to say, here are solutions, right? From mixed status family information to, public charge and making sure that we were listening and coming up with those partnership elements that could help better serve our audiences. And really taking some of those, thank you, Connie, some of those relationships that we established last year and taking them to the next level as we prepare this year with entities such as the RTC, Workforce Connections, as we try to hone in on our target audiences and continue to amplify those. So we look forward to sharing more on what those are going to look like this year. And just from an overall, communications approach, right? It was really awesome during open enrollment, working, as Julian mentioned, not just leveraging on our paid components, but as well as leveraging these added value opportunities. So through our paid advertising, we were also able to secure radio remotes. So across the state, anywhere that various radio stations were at, we were able to display, have information handy and get those, DJ mentions, as well as they were at small businesses, shopping centers, things of that nature. This year, we also had paid advertising at Mariana Supermarkets here in Southern Nevada. And they over delivered, right, in terms of what that, what they said they were going to do, and just making sure that we continue to amplify the message as our community was ordering their delicious tacos and soft drinks. If you've never been to Mariana's, I invite you to. And really just, grassroots, and as a lot of meeting our community where they're at, and making sure we're getting creative. And I was so honored to work with Griselda and Gina. And that's another great thing with Nevada HealthLink, is the amount of Spanish speakers that you have at the entity that we can lean on to be those continued experts that speak the community's language, that look like our community. Even the CFO, right, was able to join in and meet Councilman Martinez in Reno, and making those relationships and those connections. So we did a whole media blitz across Southern and Northern Nevada, worked with our partners. We're at supermarkets, radio remotes, and incorporating those back to social media, and making sure that our community saw, and we incorporated more video, targeted posts to make sure that we were also highlighting and thanking our partnerships, as well as through our own database of stakeholders for our entity, making sure that we were being timely when it was specific call to actions with the toolkits, with the video, with the content. And I think it, shows with the 35% open rate on average that we got across all of our email blasts, that it's something that the community continues to be hungry for, that information. And I think, as Tyson, and I applaud, everyone that worked, right, it's making sure that everything looks, is authentic and meaningful in our message, and in our content, because it continues to resonate. And whether it is they go on the website, or they tell a friend, or they tell a family member, I think it's just continuing to build on that trust and that success for years to come. So thank you for the opportunity.
Thank you so much, Erica. We'll quickly go through social media. As mentioned, our team, the Abby Agency, and Erica Aviles work very closely together to share both English and Spanish content on social media. That was a high priority for us to make sure we were engaging all of our different our target audiences. We focused on health issues throughout open enrollment. We wanted to make sure that, again, individuals saw Nevada HealthLink as thought leaders, a trusted partner in their healthcare and in their health. We didn't want to just push enrollment consistently, but again, create the awareness, the reason, and then again, that opportunity to convert. We wanted to share a few social media highlights that everyone has talked throughout, but partnership collaboration was very critically important, making sure that we were collaborating with our partners, engaging with them on social media, and that they were engaging back. We shared different community testimonials, both from business owners as well as from Laura Packard, who was a cancer survivor, a health advocate, and had enrolled on the exchange. We also partnered with the City of Las Vegas on a TikTok and Instagram Reel collaboration. You can see their team, Katie was a part of it, and then a team member from our team was a part of it. And those were done right in the last week or so before open enrollment ended. And we had very high views on those. We were very thankful to the City of Las Vegas for sharing those videos on their platforms, and it was great to be able to share them on Nevada HealthLink platforms as well. Overall, we had 2.7 million impressions on social media, which is quite high. It was a slight downtick. We do think that with the election right at the beginning of open enrollment, there was a few people taking a back seat. And then, of course, as you know, with Twitter, there was some changes in their ownership and how many people were on Twitter throughout fall. So we saw that decrease, but what we saw increase almost double was our total engagements, which is great, and our engagement rate going up. So even though we had a few slightly less impressions, we had more people engaging in the content, which means we were delivering the content that individuals wanted to see and they wanted to engage with. We feel that this was mainly driven by our highly video-driven strategy this year. we had over 2 million video views, which means that we were sharing videos, individuals were watching those and engaging with those. So that was great to see. We shared here just some of those posts on Facebook and Instagram that performed very well. People seem to very much like our Happy New Year post, but overall, we also saw posts that featured the Nevada Health Link team perform very well. And then on Twitter, LinkedIn, and TikTok, we wanted to share some of those posts. We saw great engagement of the testimonial piece, some definition pieces that we did, and then finally on TikTok, the video from last year showing the father and son, but again, a great example of us reusing content. And that wraps up the marketing report for this last open enrollment campaign, and we're happy to answer any questions anyone may have.
Thank you so much, Connie. That was an amazing report. And before I have any comments, I'll just reach out to our board members. Any comments or from anyone else? Is there any comments or questions for Connie? We put her on the hot seat now.
Can I go ahead and ask a question? This is Sarah Friedman. That was an absolute tidal wave of different approaches. And then it's so cool. And I also really appreciated the data that you provided across all of these different approaches. And Connie, you mentioned sort of using that data to modify your approach over the course of open enrollment, which sounds really interesting and I'd love to hear more about. But I also have another question about the data from the website, the demographics, and I'm wondering if it sort of maps to the target audience of remaining potential customers for the exchange in terms of demographic breakdowns. So I'd be interested to hear your thoughts about that.
Yeah, absolutely. So on the first question about how we use data and from enrollment data and then changed our approach, one big example was that we saw at the beginning of open enrollment, Washoe County was falling behind year over year. And Clark County was at the very beginning, very high year over year. And so we actually shifted some of our budget to doing more TV advertising in Washoe County specifically. We also saw that some of our rurals, many of our rurals were down year over year at the beginning. And so we implemented more geo-targeted strategies towards the rurals. And that's where we also used PR at that time to jump in. We did the rural broker interviews that Alexis talked about, and then placed a few different op-eds and letters to the editor in rural counties. And then over time, we saw the increases in rurals more match last year. So that was really exciting to be able to see that data. And then I think that our efforts helped to change the tide a bit in those areas. And then secondly, looking at website data and demographic data, we are seeing that the website data is very tied to the new enrollees coming in. So some younger enrollees, we did actually see that male and female was very equal in our enrollee data, but like I said, our website data showed a little bit higher percentage of males. And then we do intend to overlay our website data with census data and what we know about the uninsured and identify how do we target these pockets more. So that's absolutely part of our next steps as we plan for our off-season campaign and then next open enrollment.
Sounds really smart.
Yeah.
Connie, thank you. Were there any other comments? I didn't see any other hands up. If I did miss, just speak up. I just wanted to say, Connie, I look forward to hearing the results of the surveys you started off with. And I was wondering, do you think that they will be coming between the meeting or by the next meeting?
We will have them, we will be presenting to Nevada Health Link staff next week. So if we can email out afterwards, I'll defer to Ryan and Katie, but we can email the board those at that time and then follow up and present at the next board meeting. So they will be done before the next board meeting, and however we can communicate those to you, we will.
Thank you. And Connie, I want to congratulate you on that decrease in your session time and
Yes.
also increase in your, open rate. It's just really amazing. I remember when we had quite a bit of difficulty, even getting people, not just to have a shorter time, but just getting them through. In the early days, couldn't even get them through. So the success rate of them being able to completely enroll and to do it in such a short time, this is like totally miraculous. And I just wanted to say, as someone just alluded to, we've wrapped up open enrollment, but we'll be going into the rest of the enrollment for the rest of the year. Not over yet this year, not completely ends. As of course the public health emergency ends, we look forward to that and need to be properly and efficiently transferred. And I know last time, I believe, Ryan, you had mentioned how many potential new members we might have join us during this transition. And I don't remember the amount. Did you say something before?
For the record, Ryan, hi. Dr. Jameson, those numbers are always fluctuating. And as we close to April, we'll probably have closer numbers. But I want to say that the last numbers I heard publicly was at a presentation at the legislature last Friday, and possibly up to 200,000 or so Medicaid enrollees may be found redetermined ineligible when they start doing these redeterminations. Now that's over a 12 to 14 month period. It's not all at once, but those were the latest numbers I had heard publicly spoken.
And that is an incredible number of opportunities for the organization, the exchange, and you certainly have postured yourself to capture as many as is humanly possible. And then I wanted to say to our marketing that, again, the testimonials were amazing. They were such great testimonials. And if anybody listening today hasn't seen them, I hope you'll go on the website, try to see a couple they have there, but they were just amazing. Ryan, I just wondered, when would the automatic voter enrollment start taking place?
That date is to be determined, but we will be following any changes to that legislation from last session. We'll be following that this session to see when that will actually happen. There are some dependencies that I think the Secretary of State's office had to do first to then incorporate the different agencies that have been named automatic voter registration agencies. But I want to say the last time I looked at the legislation last year, it would have been 2024. I just don't know where they are in their processes to have their process set in stone for us to then integrate with them. And I can give an update. I can give an update at the next board meeting if that would be helpful.
Yeah, that would be nice. We can put it on our agenda.
Sure.
And we had talked about, the family glitch being fixed and that the ability to recalculate was on our website. Was that on there from the onset of the open enrollment?
It was. We got it in before open enrollment started.
That was close and that was great work. What I'd like to do is, if there are no other questions, other than say thank you so much to our PR and marketing, I'd like to move on to a few of these action items. And is that all right now if we move on to that, Ryan? The tribal sponsorship program implementation and waiver for the tribal exchange representatives. We wanted to ask for a vote. Is that correct? A motion?
Yes.
Yes.
And I'll let Tiffany Davis, do you need a quick summary or are you good to vote on this, Madam Chair?
I'm fine to vote on it, but if any other board members, we did talk about it last time. And so if there is a motion for the tribal sponsorship program implementation and waiver, the waiver for the tribal exchange representation, I would like to, can somebody
So
make a
moved, Jose.
motion?
So
Mhm.
moved, Jose
And
Melendez.
a second?
I'll second Quincy Branch.
Thank you, Quincy. Were there any questions on this issue or discussions? Hearing none, then everybody in favor, if we could say yes or yay. Yay. Do I have any opposition? And hearing no opposition, then that would be passed. And I look forward to hearing more about the implementation of the of this tribal exchange representation. And do we have any idea, Ryan, as this comes to fruition, what kind of membership we might be looking at increasing here?
I don't think we have those numbers readily available right now, Dr. Jameson. Tiffany, if I can ask you, do you happen to have any updates on this or any information on possible possible population size this might affect?
Tiffany Davis, Tribal Liaison for the Silver State Health Insurance Exchange, for the record. Honestly, that is a great question. And I'm gonna, when it comes time for public comments, I'm sure Angie Wilson could give us more insight on that. She's very, very familiar with population sizes. I know she knows specifically for her clinic what they're looking at and her numbers. So I'm sure she could expand upon that at public comment for you, Dr. Jameson.
What I would like to do, thank you so much. Let us move right on to the adoption of the 2024 carrier premium fees to be charged to our insurers. We've seen this on the website posted under the notice of hearings of fees to be charged to insurers. And I would like to, at this point, ask for a motion to adopt the 2024 carrier fees to be charged to insurers.
So moved, Jose.
And I move adoption of the 2024 fees to charge to insurance.
Perfect. Thank you, Levon. And everybody in favor? Oh, any discussion or questions on that? Okay, hearing none, then everybody in favor of passing and the motion to adopt the 2024 carrier fees to be charged to our insurers, say yay, yay.
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 Aye.
Good. Any opposition? Hearing none. And I think Quincy was just scratching his head because I heard him say yay. Then the motion is passed. And then finally, if the board members had any other comments or questions, otherwise we go to discussion of possible actions regarding dates, times, and agendas for future items.
And Madam Chair, board members, the next planned meeting is for June 22nd at 1:30 p.m.
Very good. And it sounds like we'll have some additional information on both the survey results and on the how the tribal exchange is going and representatives is going. And was there any other follow-up that the board members wanted to request? Hearing none, then I think it's time for our public comment. Was there any public comment? From north or the south?
I see Angie Wilson has her hand up.
Hi there. Thank you so much. First, let me just say, this is such a great day. It's very exciting that the Nevada Health Link Board of Directors is supporting the tribal enrollee representation so we can start moving down this path. I know our tribal leaders will be looking to get the feedback from today's meeting. I want to thank all of you for voting on this and supporting this effort. It is so greatly appreciated. Just to give an idea on the size here of the amount of American Indians and Alaska Natives we see here just at the Reno-Sparks Tribal Health Center. And I know, you know, we have other tribal health centers represented here as well with their own patient population. We serve about 8,000 active American Indians, Alaska Natives just here at this clinic. And while we have several of those that are eligible for Medicaid, we are actually looking at offering these types of services or tribal sponsorship for the majority of our remaining patients here within our tribal health center. So we're very excited for this, very looking forward to it. The one additional comment I just wanted to add is I think it's exciting to hear all of the marketing efforts happening in the state around other ethnic populations. And I would propose the board to consider options to allow, you know, the marketing firm to be able to print some of the print material in Paiute, Washoe, and Shoshone language as well. Those are the primary languages of the Great Basin tribes here represented in Nevada. And we'd be very pleased to be able to work with you all in that effort as we market these types of services to our tribal communities. So thank you again so much for today's effort. This is a day that will go down in our history here with our tribal health directors and our tribal leaders. Thank you so much.
Angie, thank you so much for your current support for the exchange, as well as the early support that you have that you gave when you were a former member of the board. And thank you so much for the support of this minority group in our state. And I know I never get tired of saying it, but as we know, every person is of infinite value. And so their health is so important. And thank you for watching out for this minority population, that they are not marginalized and lost. Thank you so much. Angie, that hand up is from before. There was nothing else? Any other?
Record, hi, sorry. Real quick, thank you, Angie. And I just want to let you know that I will connect with you and we'll work on getting those resources translated. That's great.
Thank you.
So I would like to again thank Ryan Heyer, our director, for the amazing leadership, and his entire staff for the strong work they did in the open session. And I thank them as we move forward because of all of the wonderful work they've done, everything they've laid out so that we're going to be able to capture many more individuals this year with the end of the public health and with our new tribal exchange representatives. And it's just really exciting. Undoubtedly, by the end of this year, we will reach probably our all-time high number. I thank everyone for this amazing support on this program of the exchange and making sure every Nevadan has healthcare. Were there any other questions? Hearing none, I think we could just entertain a motion to end. And again, thank you, everybody. Also, PR and marketing. Amazing.
We adjourn.
All right, I'll entertain that motion. Everybody in favor? Aye. Thank you again so much for your time to our board members. Bless you and have a wonderful day. Thank you.
Thank you.
Take care.
Take care.